The Gaza Strip's health system stands on the brink collapse as INGs damage hospitals and ambulances, and generators run out of fuel. This shows how quality medical care is a casualty war. Get the full WP experience. Choose your plan. ArrowRight Terrifying scenarios await medical professionals in Gaza. Faced with dwindling supplies of basic resources like electricity, water and anesthesia, doctors are forced to face heartbreaking decisions about whose lives to save. The growing humanitarian crisis is driving healthcare professionals into critical contingency planning following both man-made natural disasters, assessing staff and other resources, managing existing health needs as well as dire new health needs, looking after their own well-being. When we're in a disaster environment or conflict, we often have more patience than resources. We have be very creative, be able provide the best care more people, said Lindsey Ryan Martin, Director of Global Disaster Response and Humanitarian Action at Massachusetts General Hospital in Boston. The healthcare crisis extends beyond Tuesday's deadly explosion at Ahli Hospital in Gaza City. Aid agencies say the war continues to endanger an already beleaguered health system. Gaza's Ministry Health said 5 hospitals were out service as Thursday and 14 health facilities were closed due to lack fuel and electricity, after Hamas militants launched an unprecedented cross-border attack Israel on October 7. Israel placed a total siege the Gaza Strip, cutting off electricity, food, fuel, and restricting access to medical supplies. Cross-border travel by high-level figures, risk diagnoses or operations. Assessing and verifying the realities of medical care in Gaza has been difficult due to difficulties in communicating with medical professionals and limited access by reporters. UN Aid Chief Martin Griffiths told Washington Post on Wednesday that the hospital explosion has worsened humanitarian crisis in Gaza and decommissioned a hospital that treats 45,000 patients a year. Why should healthcare workers stay? Griffiths said. And what we've been discussing over the last few days is, how do you move patients coming out of the hospital in Gaza City while they're in intensive care units? They said doctors resorted to treating injured patients on the hospital floor, some without anesthesia. An anesthesiologist from Al-Shifa told the Post that bodies were left in the hallway after attempts to save people failed. He shared video he shot showing chaotic scene, patients being treated on turquoise floor, man begging others to remove the body to bring in another patient. The hospital employee, who asked not be named because she was not authorized, comment reporters worries that infections will increase due the lack of clean water and electricity desalinate the water. He's already seeing increased infections, diarrhea and fevers, and fears more dehydration in children. The hospital worker said he last slept properly on Octo.